All right, we'll call this meeting to order, the Legislative Committee for Wednesday, February 14th, 2024, at 3:36 in the room 54 of the Dunn County Government Center. The first order of business is call to the roll. County Manager, would you do that for us?
Here. Present.
I'm present.
Here.
Here.
Yes. Supervisor Vogel? Here. Supervisor McCullough?
Here.
Supervisor Prochnow?
Here.
And I believe Supervisor Calabrese is going to join us, but he thought he might be just a.
Thank you. Next order of business is the approval of the minutes, January 10th, 2024. What's the board's pleasure? Supervisor Morehouse moves, Supervisor Edlin seconds. Is there any discussion, corrections? Hearing none. All those in favor signify by saying aye. Opposed? Same sign. Motion carried. Thank you. Public comments. Do we have any that we're aware of?
No.
Thank you. Next order of business, or the order of business, I guess it is the consideration of actions to be taken by the Legislative Committee resolution on HSHS Previa collaboration. Would you like to enlighten us on that, Supervisor or County Manager Corpola?
Sure. So this, the landscape with regard to the closure of HSHS in St. Joseph's and St. Joe's and the Prevea in Western Wisconsin has sort of changes by the day, certainly sometimes by the hour. So about 2-ish weeks ago, I received a request from the county administrators in Chippewa and Eau Claire counties asking if we would consider joining in a resolution along with the related municipalities, larger municipalities, City of Menominee, City of Altoona. Those are the ones, City of Chippewa Falls that come to mind, with regard to asking Prevea and HSHS to sort of slow the processes and engage with their community partners. Keeping in mind that the impact on Chippewa and Eau Claire counties was much more direct than some of our impact, although our impact has not been inconsequential, but they have a direct. So for instance, the administrator in Chippewa County told me that almost every department in their county is impacted in some way, whether it's from the fact that they no longer have mental health or substance use services, or they don't have someone to do their fitness for duty determinations. They don't have a place to do their blood draws. They do not have a morgue or they don't have a resource for storing deceased bodies. And so that's a direct impact for them. So there were just multiple impacts for them. So there was a draft forwarded of the resolution, which you have available to you for consideration today. Again, it was just formatted into our format, but it's the language has been and is being proposed across all of those different entities. Now, that being said, let me really quick find, just before we came today, there was an email which I received with a press release. So in addition to that, I was asked to, when COVID was in its busiest form, the Eau Claire and Chippewa, kind of the Chippewa Valley, formed a kind of a COVID task force. I don't know exactly what its official name was, but we had a similar one with our partners here in Dunn County, but they had one. They resurrected that task force and now call it the Eau Claire Chambers HSHS Purveya Task Force. And that has a government affairs committee that I was asked to be a part of, again, with the other county administrators and kind of municipal leadership from the Chippewa Valley. And I was gone the first meeting, but I did attend last week and will attend again this week. So they put out a press release today, the Eau Claire Purveya Task Force, basically saying, I'm not going to read you the whole thing. I will forward it to you. It literally came right before I came down for the meeting. So there's been conversation about Oakleaf Medical Network considering buying and opening a community hospital in that in the HSHS building, and that is currently in legal discussion. So that's not something that the task force or anyone else is in a position of being able to talk about. This past week, several communities and counties passed resolutions asking HSHS and Purveya to collaborate with local health partners to ensure safe and adequate care continuity plans for patients impacted by the hospital and clinic closures. And that's the one that you have for consideration today. The task force has learned that Marshfield Clinic Health System is doubling its labor and delivery beds. And so you'll see in that resolution, there were an potential impact of 900 persons who are pregnant and are going to be in need of that were being served by the Purveya HSHS system. Marshfield's expanding from 8 to 20 beds would accommodate about 550 of those births. So it doesn't fully meet the need, but it does diminish the.
Excuse me, County Manager, can you put that resolution up on the screen? Some of us don't have a copy of it.
I can, if you give me 2 minutes to finish this part, and then I'll pop it up there for you.
All right, thank you.
So then they had asked, so there's a lot of conversations. Mayo is evaluating what they're able to do. In addition to the increase in patients needing care, healthcare workers and students have been impacted. And again, I will forward this to you. So there are a number of other providers who are expanding, already had plans to expand into the Chippewa Valley. North Lakes Community Clinic, which is a federally qualified healthcare system, is expanding into the area, as is an organization called the Remedy Mental Health. And I don't know more because I haven't had a chance to read this whole email or this whole press release. So, and the other point of to be made is that early on, HSNHS and Purveya were not particularly open to conversations with their community partners about their plans. They have since indicated, and there was a word he used in this press release, something about unwavering support for conversations with key stakeholders around continuity of care. So it sounds as if there's been some shift in their approach to this. I will find the resolution. And then I just want to say, so a couple of other things that I shared last night with Community Resources and Tourism, where we had a similar conversation. Probably the largest impacts for Dunn County, outside of the people who have a partner or a spouse who work in system, those systems, but probably the main impacts for us would be the loss of mental health bed space at Sacred Heart. There were 20 beds, and it was our only facility that served kids. And so now those kids would all go to Winnebago if they were in need of a placement, mental health emergency placement. Similarly, the closure of Ellie Phillips, which is already closed. They, originally the notification of the closure of the systems came out on February. Or I think they thought that I think it would, they received notice on February 2nd. Anyway, they thought they would have until later on, and then it closed immediately. So maybe there's a week in there, but anyway, they're closed already. So that leaves Arbor Place, who has already been the only provider of substance use services from this point west to the Minnesota border, leaves Arbor Place and then about 45 beds of inpatient treatment at the Fireman Center in Eau Claire. So that's a significant loss of that. And Ellie Phillips was the medical detox provider for the region. So if you were picked, say for instance, if law enforcement picked you up and you were extremely intoxicated and it wouldn't be safe for you to be detoxing at home because they didn't know, or you have been using substances extensively and you would be likely to have a physical impact like DTs or a stroke or whatever, Ellie Phillips was the provider of medically supervised detox, and that no longer exists. Couple other impacts. So this is just an interesting little side note. So a number of people in the Chippewa Valley have Prevea 360 as their health care provider, health insurance provider, and this is not considered a qualifying event for that insurance. So they now, because the provider is still in existence, it's just not in existence in the Chippewa Valley. So those people need to, in order to remain in network, need to travel to Green Bay or Wausau or some other part. So there are a number of people who are in the midst of, cancer treatments, et cetera, who, and I would guess even maternity for that matter, who will be looking at significant obstacles to regularly obtaining care. And then the last thing that I would note would be that one of the things that I've read in this that I hadn't previously considered was just the impacts on schools. So schools do projections on their number of kids that they're going to have and, gauge their growth and their staffing and all of those things accordingly. And now when you have potentially families who need to leave, what does that do in terms of those projections for schools in the Chippewa Valley around how many students that they're going to serve and all of those kind of impact to that. So it's just something that I hadn't really thought about in relationship there, but there are many, many ripple effects to all of this. So let me find the resolution, and it basically asks again for them to kind of slow or at least join the table to have conversations about mitigating the impact of the closure.
Mr. Chairman, may I?
Yes, Supervisor Morehouse.
No
Another
hours.
another
Oh, we have one
outcome
already?
of this,
Uh-huh.
particularly given the crushing shortage of mental health beds, is increasing costs to law enforcement. Because if there's no place to go, they're going to have to be driving across the state to Winnebago, because these people are in crisis and it's not safe to transport them without law enforcement. So, I mean, I don't know what those costs would be, but I would guess that they might be significant.
Thank you. I just might add as just a local flavor for my home community. I think the synergy co-ops are covered by Prevea. So there goes their healthcare, and that's a pretty, synergies became a pretty big operation in the 3 or 4 county area that they serve. So
The other note, I did forget, one other impact is our first just 3 program in the Department of Human Services, their occupational therapy and physical therapy were provided under contract by Prevea. So they, as well as almost every other county in the region, are looking for occupational and physical therapy services. So this is the resolution. Again, it's somewhat straightforward, resolving that utilize the entire transition timeline, asking them to utilize the entire transition timeline to allow community stakeholders, including but not limited to the medical community and local municipalities, to work collaboratively to ensure a continuity of service within the community for the health and well-being of the residents. And then the background information has some of that information, which I shared with you, probably the top paragraph being most impactful. They maintained 140 beds. They were serving 900 expectant mothers, 100 cancer patients, and 50 dialysis people. And then we're also providing healthcare services in areas such as wound care, psychiatric and AODA treatment, hospice, among other things. And the Prevea and HS accounted for 13% of the gross domestic product of the local community with 1,400 employees.
Does anyone have any questions for County Manager Corpola? This is a devastating blow to our area. I was employed at Uniroyal when that closed down. We had about, I say 1,500 people working there. Our payroll at that time was $50 million. And they say a payroll rolls over 7 times in your economy. I have no idea what the payroll is at Sacred Heart or Prevea, but this is a double whammy because not only is it an economic impact, but it's a health impact. So I would entertain a motion to adopt this resolution. Supervisor Kinnear moves, Supervisor Morehouse seconds. Is there, yeah, I'm punishing you. Yeah. Is there any comments? Hearing none, all those in favor of this resolution, vote aye.
Aye.
Opposed, same sign. Motion carries. And unless I am misinformed here, County Manager, that would, we got to schedule our next meeting. Well, we schedule it as needed, so.
So I'm going to slip in a conversation around next meeting into this meeting, whether it came in here or you're all here. I wanted to talk about the legislative agenda presentation next week. So I sent out about a month ago, a little bit more, invitations to all of the 6 legislators for Dunn County. I immediately received a response from Senator James and Senator Staff Schultz offices saying that they would be in attendance, which was like, okay, so we have 2, good to go. Since then, and Representative Moses indicated that he would not be able to attend because he needed to be at a meeting in Madison. Since then, I received a message from Senator Staff Schultz's office withdrawing his ability to attend because the legislature is still in session. And they're trying to wrap up in this week and next week. So I had Kim Leach in our office reach out to the other offices and got very, non-committal responses because it's all moving and changing for them in terms of what comes to the floor and when. So Representative Petrick office said, it would be down to the kind of the last moment of knowing. Senator Sommerfeld said he probably would be in session on the 20th and the 21st. So I wanted to gauge your thoughts.
Senator Smith also said he'd be, I talked to him this week and he has meetings with like a couple Native American community things that are same day. So, because I was asking him about something else and I was reminding him about our thing and he goes, I'd rather be there, but it's in session. So there's one more in the can't attend column.
So after that happened, I went back and I'm like, okay, let me go back and look at the legislative calendar. And so when it's published, like I looked at the one that's published now for 2025, it's very vague as to when they're going to go into session and when they're going to come out of session. In a non-budget year, they're not likely to allocate any new monies to another project. I mean, so if anything that we would ask for that would have a price tag attached is not likely to have any action taken on it in this legislative year. However, next year would be a biennial budget year. So I'm wondering whether or not I guess this might be, I don't know if it's my recommendation, but a consideration, to cancel next week's meeting and then look at those things that have particular budget. We can provide our legislative agenda to the legislators without the meeting, but then look at kind of late fall, those things that have budget impact, and maybe think about doing our sort of budget related requests in November-ish, so that it's in preparation, so we don't hit that trying to fit it into the legislative cycle. Although next year will be an election year. I don't even really know what it means. And well, budget, but if we wanted something that we wanted to be included in the budget, we probably should get it to them late year, very early the following year. But once you get into January, then you're into the new legislative cycle, and then it gets harder to schedule again. So I was thinking like sort of late fall, we already know what we might want to be requesting monies for, not specifically probably us, but in general, and that we could present it then. But I'm kind of open to whatever people think. I just don't think that we will have attendance next week because of the legislature being in session.
I guess,
That sounds,
excuse me, go ahead.
thanks. Yeah, that sounds reasonable to me. I might suggest October, because I don't think we want to have it run into budget. So November wouldn't be great for us, or we could have a special meeting in December.
I guess, thank you, Chairman. I would favor October. You don't want to get into December. The last 2 weeks of December, nothing gets done. So, and the earlier the better, I think, from my standpoint. And is there any other thoughts on this, please?
That's why they don't want to be here. Well, yeah, why is it?
I mean,
Yeah.
we may want to rethink how we present our agenda so that we're maybe trying to get them to make a commitment about certain issues in the campaign. I don't know, but that, we can decide that later.
The other thing that I thought, and if we postponed it, it would allow you, you don't have to discuss this today, but do we look at getting it a broader audience in the sense of, do we invite for instance, the city and the townships to bring forward items as well, and then have them in a list and then have them do a brief presentation? It's just an idea around, I think one of the things from a legislative standpoint, I would guess, is sort of the larger your target audience and your attendance, the more attractive that becomes.
I agree, Chris, and I think we could have like a super town hall. We should invite all the municipalities, and it's prior to the election. That'll draw their attention, I'll guarantee it. And so I think that's a good idea. We can flesh that out as we move ahead, but unless there's some disagreement here or some other better ideas, I think that's our approach, because our approach so far has been, we're pretty fired up about it, but they never seem to be. So we gotta figure out a way to light them on fire. And I don't know if it'd be appropriate now, but Nick, you could probably tell me, but it's not on the agenda, but can we just cancel that meeting for next week?
It hasn't been noticed yet.
It hasn't been noticed.
Well, do we need a motion on that or not?
No.
Probably not, because it's not on the agenda.
Yeah, the meeting notice hasn't gone out yet. Right now, it's just a devilishly good plan.
Yeah.
Yeah.
Well, as we leave this meeting today, then we will not have that legislative get together with the phantom legislators. And we'll plan to, and I think that's a good idea. I think you get your township people there, you get your municipal people there, you get your city people there, and the county board here, and it'll lend a lot more weight, I think, to what we're trying to accomplish. So,
And probably a change of venue.
yeah, we could, we can have a bigger place. I don't know where we want to have it.
Well, and I think if
Judicial
we have
center,
us-
we could have it at the gym at the Menominee. Don't matter where we have it.
Yeah, and I think the social mixer aspect that we've been talking about for this next one, I think that will go better if we have essentially a super town hall. It gives us a chance not just to talk to our legislators, but to form some other cross links with the municipalities.
I think I agree with what he said, but I can't hear him.
You're pretty quiet, Kelly.
I'm sorry, I'm trying to not pick up too much of the
That, well, we had the same
airport
problem
sound.
last meeting
Yeah.
with, so I don't know where the sound is.
Okay, well, I will hold the rest of it then for later, since we're not worrying about it until October anyway.
All right. Yep. I think that concludes our meeting. The next meeting schedule as needed. So we've concluded our business today. I want to thank everyone for coming, and we are adjourned. Yes. Wow.
No food.
I can tell you, when I see those legislators, they're going to pay for that. Yeah.
He'll make them and he'll make everything himself.
Yeah. We'll start the executive meeting after a brief pause.